Certified Nurse Aide Practice Exam 2026 Personal Care Skills 40 questions. Question 1. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 2. A resident refuses a bath. You should force them. Respect their refusal and report it. Call their family. Tell them they smell. Residents have the right to refuse treatment. Question 3. When a resident is on NPO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 4. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 5. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 6. What is a living will? A bank account. Legal document about end-of-life care. A birth certificate. A list of belongings. Advance directive for medical wishes. Question 7. When feeding a resident, you should rush them. Offer small bites and wait. Use a straw for everything. Talk to other staff. Prevents choking and promotes dignity. Question 8. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 9. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 10. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's, upright, aids lung expansion. Question 11. A resident wants to complain about care. You should tell them to be quiet. Inform the nurse or ombudsman. Ignore them. Tell them they are wrong. Residents have a right to voice grievances. Question 12. A resident is angry and shouting. You should shout back. Leave the room. Stay calm and listen. Call security immediately. Therapeutic communication involves staying calm. Question 13. How often should a resident be repositioned? Every 4 hours. Once a shift. Every 2 hours. Once a day. Standard is every 2 hours to prevent pressure sores. Question 14. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts, Heimlich, for complete obstruction. Question 15. A resident falls. What is your first action? Help them up. Call for a nurse. Move them to bed. Give them water. The nurse must assess for injury before moving the resident. Question 16. Post-mortem care is for: before surgery, after death, after birth, during sleep. Care given to a body after death. Question 17. When dressing a resident with weakness on one side, dress weak side first. Dress strong side first. Dress both at once. It doesn't matter. Dress weak, undress strong. Question 18. What is the best way to prevent the spread of infection? Wearing gloves. Wearing a mask. Hand washing. Using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 19. A resident is in isolation. What is done with their linens? Double bag them. Wash in the sink. Throw them away. Shake them out. Double bagging or special handling per facility policy. Question 20. Which of these is a sign of skin breakdown? Redness that doesn't go away. Tan skin. Dry skin. Freckles. Non-blanchable erythema is a stage 1 pressure injury sign.